Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona, co-founder of Kidney Coach and Kaigenesis, a range of kidney supplements designed for those diagnosed with chronic kidney disease, wanting to decrease their creatinine and improve their renal function. And I'm joined again today by the amazing, wonderful Jessianna Saville. She is the lead renal dietitian at Kidney Nutritional Institute. She is a regular guest on the podcast, very well versed in all things renal and kidney disease, has been in the field for a long time. She's an educator, published author, and is probably one of the greatest minds I know when it comes to really digging into understanding chronic kidney disease. Jessianna, welcome back, and thank you for joining me again.
Thanks for letting me be here.
So it's interesting because you went down the rabbit hole of initially looking at, for anyone that watches our channel regularly, you know, Jessianna and I have been wading through amino acids and their role in chronic kidney disease. And Jessianna was off to research leucine and report back. So I was like, I don't know anything about leucine apart from it's a branched chain amino acid. And when Jessianna came back to me, she said, actually, there's not a lot of research, but there is a heap about it being a branched chain amino acid and then versus essential amino acids. And then we went down the rabbit hole of ketoanalogues and when do you use an amino acid supplement in, especially in stage renal disease versus straight keto analogues, or when would you just use a branched chain amino acid? And the interesting thing is I actually had a couple of patients email me and ask me the exact same question a couple of weeks ago. So that is the topic we're going to discuss today. When do you use essential amino acids over, say, a keto analog? And then when would you use branched chain amino acids versus a keto analog versus essential amino acids? And what even are they? So maybe we'll just start with branched chain amino acids, Jessianna, for those that don't know what the three amino acids are that make up branched chain amino acids, and then we'll just start the cascade of conversation from there.
There's a lot to go through, and it's really fun to dig into this because I think that protein gets too much of the limelight without actually understanding all the components of protein, which are amino acids. So for anybody listening, you may be familiar with branched chain amino acids. If you've ever gone into a GNC or any sort of a supplement store, you're going to see them on a lot of fitness, muscle building type supplements or protein powders. They'll say BCAA, branched chain amino acids. They are traditionally used by people who want to accelerate muscle growth. They push a particular muscle growth pathway, the mTOR pathway in particular. And so people will take them if they're trying to build a bunch of muscle mass. We came into this, or I came into this because like Fiona was saying, I was like, okay, let's dig into leucine and CKD. And I found like one study where they did a leucine supplement on hemo patients and saw their response to exercise. And I was like, meh, I don't know. This doesn't tell me what I want to know. I want to know, is there a particular function of the amino acid leucine or isoleucine with the kidneys that I need to know about? And I just wasn't coming up with anything. But what I did find is there was a lot of studies on branched chain amino acids. Now, branched chain amino acids are only 3 amino acids. It's leucine, isoleucine, and valine. So there's only 3. And there's a lot of amino acids. There's only 3 in a branched chain amino acid. They do have an amino group on them, a NH2 group, which is nitrogen. And this is really important to understand for the rest of the conversation. Nitrogen is top of our mind with kidneys. If you've ever gotten your labs done, you will have got what a lot of my patients call their BUN level or your BUN level. That is blood urea nitrogen. So nitrogen is filtrated. I don't know if I said that word right. It's filtered, filtered through the kidneys. And so nitrogen is important, really important when you're considering what, amino acid supplement you take. So branched chain amino acids, that's kind of like the basis of how you might be familiar with them. And in the kidney world, there is actually a good amount of studies on branched chain amino acids with CKD in particular. And I would even say there's like a little bit of controversy with like, should we use them, not use them, and you know, a good amount of papers on them. So
Yeah, they're interesting, right? So keep going. Yep.
so okay, so that's branched chain amino acids. Keto analogs are amino acids, and there's multiple amino acids in a keto analog, but they don't have that NH2 group, the nitrogen group that I just talked about in a branched chain amino acids. They're like all the amino acids without nitrogen. In order for the body to use them, it must attach nitrogen to them in like on consumption, and then they can be utilized. Then we have essential amino acids. So essential amino acids are amino acids. They're essential. So that means that we can't necessarily, like our body can't make them. We have to consume them in some way. So essential amino acids are made up of lots of different amino acids, and they do have a nitrogen group. So the keto analogs are typically for kidney disease because they have the nitrogen group removed, but they're quite pricey for most people. And so it's a common question for people to say, hey, I'm following kind of a lower protein diet, but I feel like I need more like amino acids in, but I don't want to add more protein. So can I just take an essential amino acid or branched chain amino acid instead of a pricey keto analog? And that's kind of where I think we want to focus the conversation, because that is a complex question. So background, and then we can go on from there.
Yeah, no, perfect. And yeah, that is a question I get asked a lot. So for anyone that hasn't previously understood what keto analogs are and why you would use them, Jessianna and I did a podcast about this maybe a year ago now, but the overview of that conversation was in end stage kidney disease, generally when eGFR is 10 to 15, where someone might be waiting for dialysis, or someone doesn't want to do dialysis and they want to bridge that gap before having a transplant. And people say, is there a way that I can avoid doing dialysis while I wait for a transplant? Something that Jessie and Anna and her team at K&I do, definitely something that the kidney coach team do. We have a conversation with patients to say, maybe we use a very low protein diet, but we have to supplement your amino acids because they are what keeps tissue going. But you might have a raised bun, and I'll let Jessianna describe the biochemistry and the blood tests that we would look at to make this decision. But we say, okay, let's for no more than generally 3 months, I think is what we said in the podcast. And I generally don't go longer than that. For 3 months, let's see if we can stabilize your eGFR and use a very low protein diet to give your kidneys a break, allow them time to heal, and we will supplement the amino acids that you're no longer getting through your diet with a keto analog. That is generally when we would think about using keto analogs. But as we now, as we knew then, and we know that now, is there is also quite a bit of wading through and picking out people's biochemistry and their blood test results to really make a finite decision about that. But generally the consensus I've always gone is keto analogs are generally a safer bet if you don't have all of that information. So
yeah, I mean, it's kind of like there's no nitrogen. What's your risk of taking a keto analog? Not a lot. I mean, they're just pricey. So if you have the financial resources, I think they're a fantastic option for a lot of people. I mean, we use them even for people that are higher stage kidney disease, just to like flesh out their overall nutrients, because amino acids are so critical in healing and hormones and basically everything.
yeah.
So
and it's such a and I think that's the point, is we've always gone to keto analogs, cost of living and everything else. We suddenly have a lot of questions like, well, I can't afford a keto analog. And in fairness to the keto analog producers, we actually know they are horrendously expensive to manufacture. The reason they cost so much is the process that you have to run an amino acid through to remove the nitrogen is not a cheap process. So that's why companies,
difficult.
yeah. And that's why they're so expensive. And I think there's only one company left doing it because no one was making any money out of it because it's so expensive. So people have been asking us, can we just use a straight normal amino acid powder? So do you want to go straight into answering that question, Jess? Or did you want to talk some more about maybe the biochemistry around nitrogen? Because that's the issue here, is what we're talking about, is nitrogen, is nitrogen an issue to the kidneys?
Yes, I mean, that's the core question. If you're like, am I going to take essential amino acid, branched chain amino acid, or or a keto analog? Essentially, the core question is nitrogen, because that's the difference. I mean, a branched chain amino acid doesn't have as many amino acids, so like there's a particular place for it, but it's like essential amino acid versus keto analog. We got this nitrogen, which is the difference. So how much does nitrogen matter to my kidneys? So if we kind of look at what's going on with nitrogen, nitrogen in and of itself, I wouldn't say damages the kidneys. However, when you have nitrogen in your system, right, it has to be excreted at some point. For it to be excreted, it is broken down into urea, which is that's the smell in your urine, right? So it's broken down into urea. And then there's also a component of nitrogen, which we'll talk about in a second, that ties back into ammonium as well. So nitrogen, it's like, does it matter? Well, it matters a lot if you have byproducts that are sitting in your system that you can't actually excrete well. So if your kidney function is pretty low and now your kidney cells they can't keep up with the urea and the creatinine and other nitrogenous waste, then yeah, that's going to be an issue because it creates a toxicity. It's called uremic toxins, right? Creates this uremic toxicity that is 100% a problem for people. And if you have even that as a low grade, I mean, I don't know if they measure low grade uremic toxicity when people's GFR is 30 or 40, but I can only, like, on a common sense standpoint, think that can't be good, right? That can't be driving any sort of a beneficial process. So, so again, the question is, if you're able to excrete nitrogenous waste, then you probably could handle taking a branched chain amino acid or an essential amino acid without too many issues. And so then the question is just, how do you know? Like, am I somebody that really needs to be careful about the nitrogen and the waste products, or do I not really need to be concerned about that? And that's kind of like the next layer of question you go to when you're deciding which one you should take.
So how would people know?
So in my mind, I am always looking at any marker that kind of tells what's going on an excretion standpoint. So obviously, if your BUN is like, I mean, BUN is quite a fluctuating marker. So it's a little bit like, I think you have to just use it in the total picture. You can't usually use it as a definitive, oh, my BUN's high, so I shouldn't use a nitrogen containing process or product. Because again, it's in your serum anyways. It's not in your urine. But if your BUN was like super sky high and it was kind of always staying sky high, even if your kidney function was improving, you weren't seeing your BUN go down, I'd be like, I think we got a nitrogen issue here. And that would be someone I'd be like, we really got to push some plants. And we'll talk about alkalinity in a second. Maybe somebody who has a lot of protein in their urine or spilling a lot of protein. To me, I'm thinking, whoa, like we got some major filtration issues going on here. And excretion issues. And I would not be super comfortable putting someone that has a lot of urea in their urine and like measured, or a ton of protein in the urine or albuminuria. I would be like, I'm not so comfortable with you using a nitrogen containing supplement on top of everything else in your diet. But somebody who maybe like your GFRs, 40, 50, 60, you don't have a lot of protein in your urine, and maybe it's not really bubbly, like you have really good excretion still, more or less, even if your kidney function is, your creatinine is a little bit higher, that's something I'd be like, we probably have some wiggle room. It's not going to cause a bunch of issues if you eat a good alkaline diet. And that's the other component we have to talk about next.
Yes. And yes, absolutely. So they're the same measurements that I use. So definitely, this is what I was responding to in the email. If you had an elevated bun telling me that the nitrogen was an issue, then I'm like, I'm going to feel better having you on Ketoanalogues versus using a BCAA or a straight essential. But if you're still clearing toxins quite well and cost is a really big issue, that as long as you do an alkaline diet, we can use general amino acids and we keep an eye on things. But you have to stay on an alkaline diet. So let's dive into that. So why is maintaining alkalinity through this whole process really, really important?
So another component of having a lot of nitrogen in your system is that it's more acidic. Now, our body is so smart, it's amazing. And so in one process that happens is if our body recognizes like, whoa, like we got some super acidic conditions going on. What the kidneys end up doing, because they're very smart, is they take glutamine, and we just podcast a few weeks ago on glutamine. So go back and listen to it. It's really interesting. But they take glutamine and they convert it to ammonium, NH4 plus, if you like biochemistry. They convert it into NH4 plus, you can get some hydrogen ions. And what happens when you have ammonium, which is a base, right? You think about like Windex, that's a base, right? If any of us did like 6th grade science, you had to put like Windex on like the pH strip, and it's like, whoa, this is like super purple, which means it was very basic. So when you have ammonium or hydrogen in your system, it kind of alkalinizes the very acidic conditions. This is very, very demanding process on the kidneys, very metabolically demanding. So if you much more alkaline in your diet overall and in your blood pH and your urine pH, your body is not going to have to run this process of glutamine to having now more ammonium in your system, which is also a waste product that you do not want a lot of. And it can really balance out that nitrogen load overall. And so to me, I'd say if you're going to add on, and we do this just like on simple straight, just food, right? If you're going to add more nitrogen into your system, whether it's with a supplement or maybe you're doing a little bit more meat, there are benefits to those extra amino acids. There's benefits to having meat for some people with its mineral content and, kind of fleshed out more on the amino acids. There's benefit there, but to balance out maybe some of the negatives from it, the balance point is just the alkalinity. So that's including like a good amount of plants in your system, making sure you have enough electrolytes like potassium and magnesium, these very neutralizing components of your nutrition as well. And that's kind of like the secret sauce to balance those two things together. So in summary, because that was kind of a lot. So in summary, if you feel like, okay, maybe I'm going to take an essential amino acid for whatever reason, you feel like you're not getting enough from your food, maybe you're having surgery, you need to like push a little bit of higher protein intake, you're nervous about just eating the protein from your food. So you're going to take an essential amino acid or branched chain amino acid supplement. You want to do that in the presence of a very alkaline diet. Same as if you push a heavier meat load, push a little bit more veggies.
Yeah. And tell me, because the other interesting thing with the one study you did find with branched chain amino acids is obviously we spoke about, and I'm going back to branched chain amino acids now, I think, which is the leucine, isoleucine, and valine. It stimulates the mTOR pathway, which is part of why people use it to bulk up, right? Now, it's a growth stimulator, right? So it's improving growth. So people with PKD might hear that and go, well, hang on a minute. I'm in we talk about mTOR pathway and we've got that growth thing. So talk to me what you found out about branched chain amino acids in particular, the mTOR pathway and PKD.
Okay. So this study just came out in the American Journal of Physiology. So Talking Renal Physiology. It was just March 31st, 2025. So that's like, what is it, April 7th today? I don't know, this will be released April 14th. So just a couple weeks ago, really, like brand new, hot off the press. And this article was titled Fueling Kidney Recovery, Boosting Branch Chain Amino Acid Metabolism to Overcome Nephrotoxic AKI. And I was like, whoa, this is kind of an interesting perspective. So in this case, they were using branch chain amino acids, leucine, isoleucine, valine, in particular to push the cell growth in a situation where you've had like this massive hit and kind of death of cells, right? And that's a very simplistic way to say it, but you're having this in an AKI, that's acute kidney injury. So if someone got hit by like a toxic substance, or sometimes you'll get acute kidney injury from urinary reflux. But you have kind of this, everything's healthy, and then one day it's just not, right? That's acute kidney injury. In those cases where you've had a big hit, they saw that using branch chain amino acids was really, really helpful for supporting and balancing metabolic homeostasis. So it's like helping support a healing process, because you need a lot of push on your mTOR pathway. You need a lot of leucine and isoleucine and valine to really help support cell recovery and cell growth again. And so for me, when I look at that, and I'm like, okay, well, that's good for me to know for patients that come in and it's like kidney disease happened to them. One day they didn't have it and one day they did. And we do get plenty of cases like that, totally out of the blue, and just something random happened. This would be a case that'd be like, if your kidney function is not like way in the toilet, not spilling tons of protein, I would consider a branch chain amino acid. But for patients where we have growth, I would say like kidney cancer or even polycystic kidney disease, where I'm like, we don't want to push, and we don't want to push cell growth more than we need to without balancing it in some way with focusing on gluconeogenesis, which is what you see with like fasting and ketosis. If you're not going to balance that in some way, I would not use a branch chain amino acid. Like those are people where we like, we really are not going to push on those particular pathways.
Yeah, and we definitely know from all the research in PKD that the mTOR pathway is upregulated. So you're going to be adding to that by using BCAAs. So good idea to stay away from it in that scenario. Okay, so what else do we need to say? We've covered nitrogen, we've covered the uremic toxicity and byproducts, alkaline diet, keto analogues. I think, is there anything else, Jessianna, that we haven't discussed that feels really important to this overall discussion about using an amino acid complex and when to use keto analogues and when not to use branch chain amino acids, and maybe when to use them, especially in cases like acute kidney disease? They might be really useful. Is there anything else about this discussion that we haven't completed off?
So I always like to end with like kind of common sense, so what points. Like, so what do you do with this like information? Right? Common sense. So let's just talk common sense. So let's say you're following a low protein or very low protein diet, and you're like, should I use a keto analog or not? Or should I just use an essential amino acid? On a common sense standpoint, I would say if you can afford it, use a keto analog. If you're not sure you can afford it, then you can definitely try using an essential amino acid, as long as you put a little bit of alkalinity in your diet and you get your labs tested within 4 weeks of starting it. That would be my like common sense recommendation to try that. Or I would say, what if we just do kind of a very plant heavy approach and see how far it takes you without using any supplement at all, and see what we can do with that. So that would be kind of my scaling recommendation for people with PKD, kidney cancer, or like a cell growth issue. I would not use a branch chain amino acid. That'd be another piece. But if you're in a place where you need to recover cells that have been damaged acutely, there's no evidence you're going to recover cells that have been slowly damaged over time. Just a branch chain misses. But an acute cell injury, there is, potentially some relevance for trying a branch chain amino acid. With any of the amino acids, I really feel strongly, because there are still a lot of things we don't know about them, and every person is a little bit different. There may be many things that I still don't understand about them, most likely. When you start one, I would still try and get labs done within 4 to 6 weeks, especially if you're on the lower end of the spectrum, like under 30 to 40, because if it is an issue for you, you'd want to catch it quick and then just reverse it, and it would be nothing, right? You're not going to cause permanent damage unless you're doing it for months and months and months and months and don't know what's causing a problem.
I think that is very, very wise words and really common sense. And I think that's where labs play such a role to your point. And we had a whole discussion about this related to other things before this, is you can't bypass individualization in medicine and treatment and support, and especially when it comes to kidney disease. What works for Bob will do the complete opposite in Betty. So you have to be very careful around that sort of stuff. And people do, amino acids in particular, metabolize things very differently. And, you know, you've got the whole organic acid cycle, and you can pop one thing in and get a completely different thing out, depending if you've got any heavy metals, microbes, microbiome issues. Like, it is just what you pop in here is not going to come out the same for everybody. And that's the whole point of being individual and individualized medicine, and how the K&I team and Kidney Coach see kidney disease differently. It's unfortunate that we can't say there's a one cure thing to cure everybody, and if everybody just does this, you'd all get better. It just, in all our, you know, between Jessianna's team and my team, we've probably got the accumulation of 60 plus years of, you know, qualifications, and never have we ever seen a one size fits all approach work in kidney disease. We wish we would, because then there'd be a cure for it, but it's not. It really is a very, very individualized.
Yeah, very true. Very true. Okay.
All right, Jessianna, that was great. I think that that is a question I definitely get asked in our Kidney Coach Mastery group a lot on the page, and I know you'd been asked that. So I feel very confident now of exactly, and I'm glad what I'd found, which was a much higher level than your big deep dive is the word I'm looking for, that you found matched up. So that was great. So if anyone does want their hand held to walk through the journey that is chronic kidney disease, you can reach out to Jessianna and her team at kidneynutritionalinstitute.org. I'll put up the link below. Jessianna and I have done a whole series of podcasts on here, as well as with a whole pile of her team. Lindsay is also a super genius on all things hormones and minerals. Make sure you go and listen to that. I will, again, pop their link in below. They can work with anybody anywhere in the world. If you're in the US and have insurance, they can definitely support you that way as well. They've got a heap of great resources on their website, and programs and trainings that you can also get access to that are nice, low cost, to get some deeper understanding of kidney disease. If you want to know more about what we do, head to www.kidneycoach.com. You'll also find us all over Facebook, Facebook.com/Kidney Coach, same on Instagram. Make sure you hit like and subscribe. That way you'll get notified anytime we put up more content. And if there are any particular discussions or topics that you would like us to look at, put them in the comments below and let us know. Jessianna, thank you as always for your time and your expertise and your passion for supporting people with kidney disease. It's, yeah, much appreciated.
Thank you for letting me be on here. It's always good to deep dive into some topics and answer the questions that people have that I know they maybe can't find clear answers on anywhere else. So
yeah, awesome. And thanks for listening and being part of our community. We'll see you next time. Bye.
Okay. Bye-bye.